We are several weeks, if not months now, into the coronavirus pandemic being a major headline around the world, and there's a lot of panic. Sometimes that panic for people has turned to discouragement. So today we're going to break down both the public health issue and the economic issue and try to find some peace and hope in both of those topics.
We're in Clearwater tonight. I'm Allison Morrow.
Hi, I'm Allison Morrow.
I'm Allison Morrow.
And I've gone to a lot of places.
On St. Pete Beach, Allison Morrow.
And now with my former Force Recon Marine husband, I'm going off-grid-ish.
Hi, I'm Allison Morrow. Thanks for watching this video. Don't forget to like, subscribe if you're interested in topics like this, especially if you're interested in natural health and boosting your immune system. That's the topic for today. Dr. David Ramaley of Seattle Natural Health. Dave, I first want to just say to people, we did a great video with you at the very beginning when we had just heard that there was the first confirmed fatality from the coronavirus here in the Seattle area, which is where you practice. Now we're weeks in, and people all over the country are facing these lockdowns and quarantines. It's affecting the economy now in ways that people really had not expected, just kind of out of the blue. People unemployed, can't pay their bills. So there's both panic from a public health perspective and an economic perspective, and you're going to help us break down both. Of course, people might think, well, what's a naturopathic physician anyway? Why is he talking about the economy? What's up with public health? So I want to give you really briefly an opportunity. Can you tell people, like, what is it exactly that you do? What's your educational background? What gives you the right to talk about any of this anyway?
I am a chiropractor and a naturopath. And as a naturopath in many other states, we can practice medicine just as any medical doctor would. We just can't do major surgery, and there's some medications that we can't prescribe, but we can prescribe the majority of them. We focus on lifestyle, herbs, nutrition, meditation. We use a lot of other different modalities other than just pharmaceuticals and surgery. It's an intense education. We have to pass boards. And so I've been in practice almost 25 years, and it's primarily a primary care practice. I see kids, older adults, families for all sorts of things, diabetes, heart disease, ear infections, everything. And so that's what my practice has been. And almost all those times, I'm working with nutrition, diet, and herbs. And that's how we treat many infections, as opposed to using pharmaceuticals, which sometimes are necessary, but are way overused. You know, the Center for Disease Control says 85% of the national health budget is because of chronic disease. So we're kind of using a medical system that is trying to treat chronic disease with really more of an acute type of medicine. So I feel like that's where naturopaths and chiropractors come in, because we definitely fit into that model. And I also have to say that I work with a lot of medical doctors and nurse practitioners, and I totally respect what they do. We have a great relationship. I work with a lot of different ones. We kind of understand what each one does. So in this interview, this has nothing to do with criticizing anyone's profession at all. It's just trying to shed a little light and have a different perspective. And I think since we're talking about the COVID-19 and the coronavirus, the first thing I really want to say is I've seen a bunch of the nurses, people who are working in hospitals, coming into our practice and just talking to them. And they are doing an incredible job. They've been asked to do things that I don't think they really ever thought they would have to do. They're putting themselves in danger at times. So I just want to say a really big thank you to them, because I know they're working around the clock and they're dealing with some really kind of critical situations. So I think they're doing a really good job. And also, just what I've seen with the general population is I think people are trying really hard to do the best they can during this whole time. And the biggest thing that I've seen in this last month is I've never seen this level of fear. It's really incredible. And I'll talk a little bit about the ways to help boost your immune system, but I actually call this more of a pandemic of fear than a coronavirus pandemic. Now, I want to let you know I'm not the only one who has been saying this. I'll talk about this later on, but there's been plenty of people within the scientific community that would shed the light on this and say maybe we're overreacting. So again, I'm not saying that we should be disobeying the law, that we should be doing anything. I think all the things that have been put in place in Washington State and other states are good, but we have to back up a little bit, and let's not be afraid to kind of analyze and see what's happening. And when I've had patients come in, I try to give them a little bit of a perspective of what's happening overall and what is kind of like our real risk. So again, not to downplay that there's no risk, but again, we got to put it into a bigger perspective. And what we talked about in that last interview, I still think holds true for a healthy immune system. I talked about vitamin A, vitamin C, mushroom extracts, vitamin D, And we're going to put a link, I think, into this YouTube video that basically is going to take you to the newsletter where I talk about the dosing of this. So
Yeah.
So we don't have to go into the details of that.
Right. So if you check the description under this video, if you're interested in learning more, you'll see a link to what Dr. Ramaley is talking about, so you can read to your heart's content.
Everybody has an opinion on this. I want to say that mine is not the only way. There's a lot of different ways that people can help improve their immune system. I'm just trying to talk about from my own experience. This is not black and white. So I just want to let you know, I do not have all the answers. I'm just trying to give you what I observe and what I have experienced. So I'm open to lots of other suggestions. But I want to kind of back up and say those are the supplements, but I want to talk about the biggest thing that we can do. And like I said, I see the stress level just going off the chart. So I have people who come in who have asthma, and they're having to bump up their asthmatic their medication. We also have people who are coming in with gastrointestinal problems. They're also coming in with lots of neck and back pain. And so everybody's fear level is actually producing more, what I would call more illness and stress in their life. So the things that I suggested before is first is go outside. Now, obviously, we're going to keep our social distancing, but people can still go outside and get natural light. And that is one of the best things that you could possibly do. And as I explained in that first video, when you go out and get natural light into your eye, that sinks that natural light to your immune system. So going outside, like we mentioned before, 5 to 10 minutes in the morning, midday, and at the afternoon is going to probably be one of the best things you can do to increase your immune system. Now, I know if I looked at the TV station, they have up on the little box about how many cases there are and then who just died. I mean, that's just crazy. That's instilling fear. Either greatly diminish or turn off your news altogether. Maybe pick a few reliable sources if you really want to see that. Why don't they put up there, like, what have we found is working so far? And that's why we want to flip up that article on the vitamin C. And basically it's talking about IV vitamin C, which has been around for 40 years. Now, this is an article, it's from Orthomolecular Nutrition News, and they're giving you numerous studies that have been done, some specifically on the coronavirus, some on sepsis, and some on other infections. And they have a great results with a lot of these upper respiratory infections. And so remember on that last video, we talked about how people don't actually die of a virus, they die of an infection. Or excuse me, they don't die of an infection, they die of the inflammation. And that is exactly true. That's how they can monitor how well someone is going to survive this. They look at something called a C-reactive protein. It's a test. And so it's a great one. They actually have it on the internet. It's called the Internet Book of Critical Care. And this is the one that everybody is looking at right now in the emergency room. And they say, what is the one thing you can measure to see someone's outcome? C-reactive protein. And that's what everybody is referring to as the cytokine storm. So everybody gets a strong inflammatory process. And that's where the IV vitamin C comes in. It actually lowers that whole cytokine storm and lowers the inflammation. So why aren't we seeing that on TV? And they can show great results. And there's also another one called the MARIK, M-A-R-I-K protocol. It was started by a medical doctor using IV vitamin C as well as vitamin B1 and a little bit of hydrocortisone. And in the initial study he had 20 people who were basically ready to die. They had sepsis, which is an infection of the blood and organ failure. Of the 20 people he did it on, I could be off by 1 or 2 people, all 20 survived. This is crazy. These people were ready to die, and that's why they allowed him to do it. This is kind of like, hey, we're all done, this person's dying. And so why aren't we seeing that on the news and saying, why aren't we implementing this with the people who have the coronavirus? And I'm not saying everybody's going to be cured, right? But this is really an amazing finding, and hopefully out of all of this might become actually mainstay medicine in many of the hospitals. I actually prescribe medications and antibiotics. There's a time and a place for everything, so I really don't want to discount all pharmaceuticals. It's just I think they're way overprescribed, and often there's an alternative, but that alternative does not amount to a lot of money for a drug company or whoever would benefit from that. So I think that's a big important part. And there may be other things that come out that will be much less expensive than that. And the other thing I was talking to you about, the patients who I've been seeing who have been, because of this sort of whole thing going on, what I see is a lot of their healthcare needs, going crazy because of the fear. If you're running around and you're afraid of COVID-19 and you're going to die from that, I would say, well, are you afraid of sepsis or are you afraid of the norovirus?
Right.
And most likely people aren't.
Well, and we're showing a graph globally of the cases, total confirmed now 857,487. And, I think recently Dr. Fauci talked about the media was trying to pin him down on a number of deaths in the United States that he was predicting. He really didn't want to do that. But he said if he were to guess, it would be like 100 to 200,000 cases that they expect to see of mortality. He said millions of cases of people actually getting it, 1 to 200,000 maybe end up being mortalities.
Right. How do we know they're dying of just COVID-19? How do we know they're not dying of influenza A, B, H1N1? How do we know they're just not having they're dying just because they already have, it's called a comorbidity. So it means they have two other diseases going on. Maybe they already had something and they just happened to get the COVID-19.
Let's take a look at the International Journal of Antimicrobial Agents. This is from March 19th, 2020. It's titled SARS-CoV-2 Fear versus Data. Dave, basically what it says, the issue is being overestimated. The problem, it says, is being overestimated. So what do you have to say about that?
Well, that's exactly what I was saying. They're trying to compare it to how many people die of upper respiratory diseases per year. And the COVID-19, well, they're using the more scientific term, but it's basically COVID-19 is really not, is essentially not that high of a number compared to the number of people that actually die of respiratory diseases anyway.
Right, it says...
That was the gist of the article.
Yeah, it says it is concluded that the problem of SARS-CoV-2 is probably being overestimated as 2.6 million people die of respiratory infections each year. People are getting criticized right now for even bringing up the fact that people are losing their jobs, that there is another side to this where you really do have to balance, like, one and the other. What kind of risk are we willing to take with people's lives economically? What kind of risk are we willing to take with the health side of things?
Everybody should be following the law. We're in Washington State. You want to follow the law, and I will assume that people who are making those decisions to stay at home really were acting in their best interests and we're doing their best to protect the public. I'm not denying that. And we are doing everything in our clinic to follow all the state laws, to follow the CDC, the WHO, everything. So I don't want to imply that I'm criticizing them. All I wanted to bring up is that public health is just not this one little myopic thing that we're looking at. So there's a great article that was written about this. His name is Toby Rogers, and he was the one who brought this. So I think we're looking at, is it the U.S. Congress, 1976?
Yes, 1979,
yeah, so
October 31, 1979.
79, yeah, but this is done by Brennan. And Toby Rogers is a political economist, and he's written some really good articles on unemployment. And so this one had to do with Brennan way back. This study was actually done in 1976. And so what he did is he went before the U.S. Congress and said, look, for every 1% of unemployment, 36,000 people will die. So if we go to present day standards, that's around 56,000 people will die. Now, granted, I don't think he has a crystal ball. There may be some criticism of that. But his point was, and other people have actually agreed with him on this, there is a social cost to unemployment. And so if we try to use that one algorithm, again, every 1% of unemployment, 56,000 people will die over the course of 5 years because of heart disease, stress, alcoholism, suicide. And this was a well-designed study. And then in 2011, which I believe is the next graph that we had on there, is basically in 2011, they did what's called a meta-analysis. They went back and looked at 40 studies. This was Brenner again, and found out that there's a 63% increase in mortality for every 1% of unemployment. And so I am not saying that we should stop the quarantine or we should stop the stay at home. I'm just saying it's a conversation we may want to have in the future, that public health is just not always stopping a virus. Public health is about the public and our overall health. So if we're looking at that, we already know we're not going to hit a 1% unemployment increase. We're going to go up. We already know that. I mean, look at Washington State. It's going to go up. Who knows? I don't know exactly. It definitely is going to go up 3% or 5%, and that might be overall for the United States. So what is the cost in lives with that kind of unemployment? And that's in deaths. We're not even talking about stress, heart disease, and other things because of this. So all I'm saying is we need to look at the overall picture, and it would be a good thing to have in an overall discussion and looking at when we do these really, what I would call at times draconian measures, although sometimes they may be necessary. But in this case, we might want to look at the overall picture and give us a better idea of what we want to do going forward. Here in Seattle, we're in a high-tech city. A lot of people can work from home. Lots of people I know are working from home. But the thing about that is that this is Seattle, but you have to remember the rest of the country. There's a lot of people. When they were asked the question, if you had a $400 expense come up, what percent of the population could cover that $400? 39% said they could not cover that $400 expense. So I've already seen in our practice people coming in and they lost their jobs and they work in the restaurant industry or service industry. And those jobs most likely are not going to come back for a long time. Now they may be a single parent, they may have kids, and they've also lost their health insurance. So the only point of that is that these people are under a lot of stress. A lot of people may lose their apartment. They don't have health insurance. So there's this whole other side to the equation that we have to look at. When we look at the overall number of deaths from the COVID-19, some of the things that have been coming out from the CDC and other sources is that the people who are taking NSAIDs like Tylenol, ibuprofen was somewhat implicated in that. These one are called ACE2 inhibitors, these high blood pressure medications, that those people are dying at a much higher rate. Now this is just, this is not completely confirmed yet, okay? This was just put out there, we'll still have to see what the data shows. But when people are taking that many medications and have a couple of chronic illnesses, their mortality rate goes way up. So when we're looking about how we can improve our health, maybe during this time that we're not working, we have a time to reflect, we may want to think about what are we doing with our lives. I mean, 90% of people over the age of 65 are on 1, 2, 3, 4, or 5 medications. That's 90% of people over the age of 65. I mean, that's like crazy. And so are we having illness because we don't have enough pharmaceuticals? Or having illness because it's the way we live our lives? And so we really need to sit back and, step back and reflect upon what we're doing with our lives and how we're treating our bodies. And to me, that's the big takeaway from all of this also is like, we mentioned about the inflammation from that C-reactive protein, all those things. All those things are creating inflammation when we have a poor diet, stress, a lot of those other lifestyle factors. So hopefully from this whole situation, we'll be able to try to deal with stress and try to get away from some of these medications and look more at nutrition and lifestyle. So we just read that, we just saw the article on the fear versus data. And then the next one is from the, it's a long name.
European Monitoring of Excess Mortality for Public Health Action. Yeah.
Yeah, wow. I forget what the acronym was. It's MoMA, but all I can think of is in New York.
Yeah, Euro.
All I can think of is the MoMA Museum. But anyway, there's a blue spike, which indicates basically mortality. So at this same time, approximately, every year you see a blue spike from 2016, 17, 2018. But look at what's happened for this year. Look at the numbers. You don't see that blue spike. What that's indicating, this is just Europe, it's 22 countries in Europe, but it's actually showing that the overall mortality rate is less than it has been in previous years for whatever reason. But most likely that's influenza that you see, because that's every winter when you see that number spike up like that. And what the point of this was in an article that they were talking about is that really we're not seeing any kind of spike in overall mortality as compared to other years where it was actually much worse. And so what I would say for those who can, I would take this time to reflect on what's important to them.
Which is hard to do if you're looking at your bills pile up and you don't see an end in sight, which I think is part of the problem with this is that the deadlines keep getting extended on, I guess they're not deadlines, I don't even know what they are, these parameters of restrictions keep getting pushed back. So like first it was, talking about mid-April, now it's probably the end of April, maybe this goes into May. We're expecting our first kid May 9th, hopefully, I don't know.
I know, yeah, that's exciting.
At this point, I wish the kid would just stay until 2021, and what pregnant woman ever wants that to happen?
We got to see something that's going to come out of this. I haven't lost my job, so it's easy for me to say. I'm not trying to tell this, but there's got to be something out of this. And I'm just going to hope it's going to again be a time where we reflect about what's important and how do we want to live our life. This is a whole nother topic, but I'm going to close with this one story. Jack LaLanne, I don't know if you know who Jack LaLanne was. I'm older. Well, he was this kind of fitness guru back in the 50s, and he had this religious experience when he was like 18 years old. And basically he turned from this little frail kid to this muscular guy. He holds the world records for all these things that he did. I mean, it was amazing. He was on TV. He died in 2011. He lived to 96 years old. never took a single drug his whole life, lived his life. I mean, amazing guy, wrote tons of books. The week before he died, guess what he got? The flu. He got the influenza. He developed an upper respiratory disease. Everybody said, go to the doctor, go to the doctor. He says, I'm 96. He's going, basically said, when it's my time, it's my time. I want to leave this life full of vigor and strength and vitality. The day that he died, he went out and worked out that morning, and he died that afternoon. So maybe it's a question of not only how do we want to live, but also how do we want to die? And that'd be a whole nother topic.
Well, now we're going to be touching on my master's degree in theology and psychology. Maybe we'll save that for another day. But no, I mean, it is anytime there's a moment like this in history, I guess you hope that what we do is evaluate the big picture and that we can refocus on that and then carry that with us when times are good, when maybe we forget about that stuff and it's easier to get caught up in the minutia of life and we're not necessarily as aware of gratitude and patience and kindness and mercy and all those things that start to come into perspective a lot more when you are facing a situation like this. So it's a great reminder, and I really appreciate your being on the channel again, Dave. Is there anything you want to tell people about how they can find you? Because you do remote work and everything. They can call you for counseling if they want. If they want you to tell them that story in person, you can call Dave. So how can people learn more about your stuff and what you do?
Yeah, we've been doing a lot of the telemedicine now because people don't want to come in. I totally understand that, and we're doing everything we can to help people with that. So we're doing the telemedicine, phone consults. We're in Seattle at seattlenaturalhealth.com. But you can find us here in Seattle, and we'll do whatever we can to help people.
Well, thanks again for watching. I'm Allison Morrow. Again, if you're new to the channel, please hit the subscribe notification bell icon that you see there. Like, you hit the subscribe and then you hit that bell and it'll tell you whenever I upload a new video. Share this video with your friends and anyone else that maybe you don't like them, but you want them to have a better life anyway. So they're not your friends, but you can still do something nice for them in a time like this. It does help. YouTube has been censoring and demonetizing and shadow banning a lot of the videos on this particular topic. So we do really rely on people who are watching to get the word out about this information, which we think is really important for people to hear. Again, I'm Allison Morrow. I'll see you next time.